Hey, Dr. John here with NBC News on this Facebook Live. For coronavirus, I want to go ahead and cover a couple of headlines that have happened over the weekend, last week, and today, and then answer any questions you might have. So if you have questions, please start sending them our way. But first, let me talk about a couple things that are happening. Most of these surround the reopenings that are happening around the country and the increase in coronavirus cases that you've heard about. Now, one of the things is we've started to see higher daily numbers of cases than we've seen in quite a while. As a matter of fact, Thursday, which was just 4 days ago, we saw the highest single day increase in cases ever since the pandemic started, over 45,000 cases across the country. Now, one of the things that you've probably seen in the headlines is this doesn't seem to be accompanied by deaths, and so we're seeing more cases, but we're not seeing more deaths, which is a bit of a silver lining here because obviously the deaths are the unfortunate consequence of COVID-19. But the thing you have to remember is the deaths are not that high at this point for a few reasons. Let me go over some of those. Number one, the people mostly affected right now tend to be younger adults. The few reasons behind that is the older adults, those that are more vulnerable, those that have pre-existing conditions, I think have gotten the word over the past couple months and have said, we're not going to go out, we're not going to go to these areas where we can't social distance, we can't wear our masks, and so we're going to stay safe at home, whereas the younger adults tend to go out there, they feel more invulnerable, and they are going out there without their masks, they are going out there without social distancing, and end up getting this. As a matter of fact, in Michigan, there's one bar right now that they're looking into it, but it looks like 85 people ended up contracting coronavirus, COVID-19, or coronavirus from this bar scene they had over the weekend. And so, again, we know what we can do to stay safe. Not everybody's necessarily doing those measures. And so that's one of the reasons that the cases are going up. The death rates are not going up, but the cases are. Another reason that's happening is because the actual death rate lags behind cases. And what typically happens is we get an increase in cases. Over the next couple of weeks, we start getting an increase in hospitalizations because it does take a couple of weeks for people to get sick enough to be hospitalized. And then over the next 3 to 6 weeks, we start getting an increase in deaths because once people get hospitalized, put in the ICU, then it takes a few weeks to find out if they're either going to recover or not recover from this. And that's when the death rate starts going up. And so even though right now, cases are going up but not the death rate, don't be surprised if the death rate starts going up a little bit over the next 3 to 4 weeks. And that's what a lot of experts are looking at. And then number three, this virus has been around for 4 months. In that 4-month time period, we docs have figured out a lot better ways to treat it. And a lot of it's just information we've learned as time goes on here. Not putting out people on ventilators as quickly as we thought we needed to. There's certain medicines that can help. There's no cure for this, but medicines that can help. And just the overall supportive care is better at this point because we have a better understanding of the virus. And so those three reasons, the fact that younger people are getting it and they don't typically get as sick, the fact that the death rate actually lags behind, and the fact that we have a better understanding of how to treat this are all reasons that death rate hasn't gone up in association with the number of cases. But again, over the next few weeks, don't be surprised that the death rate does go up. But on the topic of reopening, the other thing you're hearing are a lot of these reopenings are starting to slow down and even pull back. It depends. Right now, Florida, Texas, Arizona, California, those are the states that are being hit the hardest. But every state in the country seems to be hit. There's only 2 states that didn't have their cases go up, and I believe those were Rhode Island and Connecticut. Every other state is having increasing cases. Part of this has to do with the reopening. And I mentioned, a lot of experts did about a month ago, that once we reopen, we are going to see higher numbers of cases. And that is what's happening. The issue is when these cases start getting more and more out of control, as you're seeing in some of these states, they're starting to close down on the reopenings. They're starting to pull back a little bit. Now, a lot of people are saying, well, these cases are happening because we're testing more. That is in fact true. We are testing more, and that's one reason, but just one reason behind the increased numbers. The other issue is we are seeing higher positivity rates, which means more people have it. We're seeing more people get into hospital because of it. And so those are showing us that not only are we testing more to catch more, but there are actually more cases out there, whether we test it or not. And those cases are continuing to climb, need to get those under control. And then the last thing I want to talk about is you might have heard over the weekend or even early or late last week about the actual number of people who have had coronavirus being 10 times higher than we thought it was. And now it looks like it's over 20 million people that we think have caught coronavirus. The way they found this out is the CDC looked at blood samples across the countries for a variety of things, either blood donations or other blood sample issues out there. and they tested those blood samples for antibodies. They found out that the people with antibodies are 10 times higher than we thought they were. And so what that means, again, is there's a huge portion of people that have coronavirus, don't even know they have it, and could be spreading it to others. And that's why these reopenings, we have to be very cautious with them. And what I've talked about in the past is don't confuse the two. Don't confuse reopening with the end of the pandemic. We're not reopening because the pandemic is over. We are reopening because we want to get the economy restarted. We're still in the midst of the pandemic. As a matter of fact, that curve that was coming down is starting to go up again. What that means is we all need to do those things. We need to, if you do go out and about, you need to wear your mask. You need to social distance. You need to make sure you don't go in big groups because those are the ways that spread. And if we keep that spread going, we're going to have to close down even more. And that's the hope, that we can keep the economy going, keep reopening things up, but at the same time stay safe. And that means that we all need to do those things to stay safe, to keep us, to keep our families, our friends, and our community safe, and keep the reopening going. If not, that reopening is going to slow down a little bit. But now let me see if you have any questions. But real quickly, again, the cases are going up, but deaths not necessarily. We explained that. The reopening is starting to slow down because of increased cases, and the fact that there's over 20 million people we think have gotten coronavirus off of testing blood samples for antibodies. And so that's a lot more than we thought. But let me see what kind of questions we have.
Can you please talk about the importance of wearing masks? We are noticing a lot of people don't. And were people who died wearing masks? Do they not protect you?
So the question is, explain the importance of wearing masks and why is that important? Well, first and foremost, the things we know right now that can help. And as the average person, the things that can give you the most benefit and the most protection from catching coronavirus: masks, social distancing, not going out in large groups and washing your hands, especially before you touch your face. So the social distancing, obviously, is because this virus can spread up to 6 feet. So if you keep 6 feet away from people, that can certainly help. The not going in large groups, because the more people you're around, the longer you're around those people, the more likely you are to catch coronavirus. And the washing your hands, it makes sense in and of itself, because if you touch your face, that's how you get coronavirus. So if your hands are dirty from touching surfaces, you can get it into your body, and that's how you can catch it as well. But as far as the masks, this for some reason has proven very controversial, and I'm not exactly sure why, but masks can offer you protection. They're not 100% protection, but they can offer you more protection than not having a mask. But they need to be coupled with social distancing. So you can't wear a mask and say, I don't need to social distance anymore. You still need to do both together, and that's the best protection you can have when you're out and about. The masks, again, not 100% protection. N95s give you the most protection, and then cloth masks, as you start working down different types of cloth, give you less protection, but they still give you protection. And even more importantly, the masks are not necessarily designed to protect. If I'm wearing a mask, it's not necessarily designed to protect me from you. It's designed to protect you from me, because I'm wearing the mask. So if I have coronavirus and I cough or sneeze or even breathe, talk, sing, any of those things that can get those virus particles out there, the mask is going to help block part of those. It's not going to go quite as far. And couple that with social distancing, that's going to give you your best protection. And so I hear it from people all the time, well, it doesn't protect you 100%. True, it does not protect you 100%, but it still offers you some protection, which is what we need to do right now in order to keep things going. So let me see if we have more questions.
Can the coronavirus travel over long distances greater than 6 feet?
So the question is, can a coronavirus travel over long distances greater than 6 feet? On the average, 6 feet is the distance because it's respiratory droplets. A little bit of science here. There's two different ways that viruses can spread through the air. One are respiratory droplets, which means when I cough and sneeze, those droplets go out and they go very far. Those droplets are usually 5 microns or larger, and so they're heavier. They can't go very far before they drop to the earth. The other one is aerosolized. Aerosolized is like measles. Measles can hang in the air for a couple hours, that virus. It's a smaller virus, so it's under that 5 microns. Matter of fact, it's usually under 1 micron. They're very small. They travel in the air. They float in the air, so if you go by, you can breathe those in and catch that virus. Luckily, coronavirus is not there yet, but in some certain ways, it can spread greater than 6 feet. If I'm coughing or sneezing very violently, that can make it spread more than 6 feet. Again, a good reason to wear a mask. If it's being aerosolized in and of itself. Remember, it's not naturally aerosolized, but if you're in a laboratory environment, in a hospital environment, where they're using certain equipment, it can be aerosolized that way. We also think air conditioning in certain circumstances might contribute as well, because you can imagine if I'm breathing or coughing or sneezing and that air comes by me very quickly because of air conditioning, it can push it further than 6 feet. And so in situations like that, possibly, but on the average, in a natural environment, 6 feet is about as far as it goes. And that's why we say 6 feet for social distancing. Again, coupling it with a mask is your best defense.
Should we be traveling at this time?
So the question is, should we be traveling at this time? Well, the answer is, and I tell people all the time, anytime you step outside your house, anytime you step outside your quarantine bubble, you're increasing your risk of getting coronavirus. And so leaving that environment means that you're not 100% safe, but there are ways you can make it safer. So a couple different categories. If you're particularly vulnerable, meaning that you're above the age, especially above the age of 80, or if you have pre-existing conditions, then you want to think twice about traveling. Should probably be essential travel only. But for the rest of us, if you want to travel for other reasons, visit family members, again, being safe the whole time, then traveling can be safe. You just need to do it appropriately. And that means taking the proper precautions. Again, masks, social distancing, washing hands, those types of things. If you're on an airplane, people always ask the question, air or car? What's the better way to do it? Well, neither one of them is 100% safe. Air travel doesn't take as much time, but you come in contact with more people in close proximity. Car travel takes longer, but you have to make more stops, but you're not around people quite as often. So again, it just depends on where you're going, how you're getting there. If you are coming from a hot spot, be careful, because some states are restricting people coming from hot spots to a 14-day quarantine period. If you're going to a hot spot and going back, you also have to think, do I need to quarantine myself when I go back? Will I be able to go to work? Just things to keep in mind. So again, traveling, not 100% safe, but there are ways you can make it safer.
Is wearing a mask for a long time dangerous? Does it increase your inhaled CO2?
And this question has come up over the past month or so, a couple of weeks especially, about wearing a mask. Does it make it dangerous? Does it increase your level of CO2, carbon dioxide? Now, when we breathe out carbon dioxide, which if we get too much of that, it can be harmful to us. But usually that's in closed environments where that happens, or in certain medical situations. But as far as the mask is good at exchanging air, especially cloth masks. And so what they've looked at is CO2 levels on masks, and they really haven't gone that much higher. They might go incrementally high, which means a few percentage points up, but not enough to cause you any issues or any harm. And again, the masks can actually help keep you healthy from coronavirus. Now, the big concern are the N95 masks. And what people say is, if I wear an N95 mask all day long, can it cause problems? The answer is no. In the medical environment, we wear N95 masks for hours and hours and hours on end, and you don't have people falling by the wayside because they're getting carbon dioxide poisoning. The carbon dioxide level, again, might go up a bit, very, very small amount, but not up enough to cause any issues or cause any harm. And depending on what kind of cloth mask you wear, if it's one like this, it's a little bit thicker. If it's one like this, which is a little bit thinner, then that oxygen, that carbon dioxide exchange is going to happen very freely. And the honesty of it is, most of us don't wear masks for 8 to 10 hours at a stretch. Most of us wear masks for minutes at a stretch. And so, or even a few hours. And so that mask, the carbon dioxide level is not going to go high enough to cause any issues, if it goes high at all. So,
Should schools reopen, or should we wait a bit longer? How will teachers and children stay safe?
So the question is, should schools reopen? Should we wait a little bit longer? How can we keep students and teachers safe? And the important part is there's a couple of factors to look at here. And what a lot of experts are saying is that in the fall, we should reopen schools for a couple of reasons. Reopening schools is important for children to get their learning. Distance learning isn't quite at the same level as learning in person. Plus, that social development that's very, very important to children needs to be accompanied as well. And on top of that, parents, if we start reopening, need to get to work, especially for those of the lower income status. They're not able to get that help at home, and so they might not be able to go to work if we don't open up schools. But the issue is we need to open up safely. Like I mentioned about travel, anytime you leave the house, it's not 100% safe, but there are ways to make it safer. And so what you're going to see are schools making sure students and staff stay as safe as possible. Part of that is going to be when they come in. A lot of hand washing, hand sanitizers, students wearing masks at certain times during the day. Maybe not in the classroom if they're social distancing, but if they go out to recess, if they go through the hallways, things like that, teachers and students will probably be wearing masks. You're not going to see all students going to school all day long like we did in the past. Instead, you're going to see part of the class going at certain time periods and part of the class going at other time periods with distance learning filling in the gaps so you can have that social distancing. Lunch will probably be in the classroom instead of the cafeteria. And so students are going to go back. It's going to be a new normal, but it's going to be a temporary new normal until we do get that vaccine. Same thing for keeping teachers safe. It's important, the masks, the hand washing, the social distancing, that helps as well. And one more important factor that needs to be incorporated into this at schools is the contact tracing of known cases, and the testing. So if somebody does come back with a positive test, or if they do develop COVID-19 symptoms, then they can contact trace who they've been around. Possibly a classroom, possibly classmates or the teacher, and they can go ahead and quarantine those people and make sure nobody else gets sick. So again, going back to school, traveling, opening business, any of these things, anytime you leave your house, it's not 100% safe. You do increase your risk factor, but there certainly are ways to make it safer. And it's the boring things that I talk about day in and day out. Wearing masks, social distancing, washing your hands, not being in large groups. Those are the things that can keep us safe. And those are the things that can keep the reopening happening so we can get our economy restarted. We can get back to at least a near normal until we can start progressing more towards that normal that we all are used to from the past anyway. So again, to recap what we talked about, cases are going up, but deaths are not matching them. Explain why that's happening. And deaths might increase, unfortunately, over the next few weeks. So just keep an eye out for that. Reopenings are starting to slow down a little bit. That's because the increase in cases, and governors, health experts around the country are saying we need to slow this down a bit. And we do know there are more coronavirus cases out there than we thought. This is based on antibody testing of blood samples. And so, again, that protection, everybody protecting themselves, each other, their families, their loved ones, and their communities are the way we're all going to get through this together as quickly as we can and as best as we can. But for the remainder of the week, please stay healthy, stay happy. Protect yourself and your loved ones. Thanks.